Good afternoon, everyone, and welcome to Ad America, the U.S. Embassy's American Center. With me, Patricia Elizabeth, as one of the e-guide here, and you're watching an open discussion on mental and reproductive health. Do you know, in an increasingly complex world, the well-being of young people remains a critical concern. Join the discussion until the end, ways to break the stigma and promote mental health and reproductive health in Indonesia. But before we start our discussion, we have trivia quiz for you who join us via online platforms. And the question is it true or false? Mental health is a basic human right. You can submit your answer to our social media platforms, and if you can guess correctly, you will get a live shout out at the end of this event. And now to begin our discussion, please welcome our lovely moderator. She is Health Track Chair of ASEAN Plus Youth Summit 2023. Please welcome Irene Bougainville Martin.
Hello, thank you, Patricia. My name is Irene Bougainville Martin, and I am the ASEAN Plus Youth Summit Health Track Chair, and today I'm representing in the Indonesian Youth Diplomacy. So what is ASEAN Plus Youth Summit? It's actually a youth summit which happens at the same time with ASEAN Summit, but the participants are all youths. And we have 5 tracks, which are digital literacy and inclusion, health, green economy, food security, and future of education and work. And each of the tracks, together with all the ASEAN member states and also their partner countries, come up with a policy recommendation that we submitted to the ASEAN stakeholders and also Indonesian stakeholders. And today, from the health track, we would like to disseminate one of our points in the policy recommendation, which is about the importance of access to healthcare services of mental health and sexual and reproductive health and rights. And today, I am joined by our wonderful panelists here, which I am going to introduce one by one. So this is Ms. Ashra Dazwin on my left. She is the WHO National Professional Officer in Mental Health and Substance Abuse Program. Hello, Dr. Ashra. How are you today?
Hello, very nice meeting you and very nice meeting everyone here, and thank you very much for having me.
Thank you so much, Ms. Ashra. And on the left side of Ms. Ashra, we also have Mr. or Kak Wildan R. Kurniawan, MD, MPH, who is the public health expert medical doctor graduate of Harvard School of Public Health. Hello, Kak Wildan.
Hi, Irene. Thank you so much for inviting me here. It's such a pleasure to meet you and also all the esteemed panelists here. It's a very, very privileged for me to be here today.
Thank you so much, Kak. I bet a lot of people here are wondering, how can you enter Harvard and now get back to Indonesia and contribute to Indonesia? That's a very amazing achievement. And our last panelist is Mas Indra Prasetya Adi Nugroho. He is the policy analyst for the Deputy Assistant of Youth Empowerment, Deputy of Coordination, Children Quality Improvement of Youth, and also Girls of Kemenko PMK. So, Mas Indra, how are you today?
Alhamdulillah baik. Selamat siang Kak Iren, para panelis sekalian, rekan-rekan pemuda sekalian yang ikut hadir di dalam daring.
Okay, so I think we're going to continue our discussion with English, yeah, because this is at America, so we're going to continue our discussion with English. Okay, so to set up the context for today's discussion, I would like to open the discussion by asking Kak Wildan. So, Kak Wildan, can you tell us, based on your experience, before going to Harvard and after when you're going to Harvard for university, how is the awareness of mental health and sexual and reproductive health and rights in Indonesia and in the United States? What is the difference?
Yeah, thank you, Irene. So, actually, after spend like almost a year in the U.S., I think I know the difference between how mental health and also reproductive and sexual health are discussed in both country. So the first thing is that when we talk about mental health and also sexual and reproductive health in Indonesia, we know that there is a significant stigma and also hesitancy to talk about that because of like maybe it's like a cultural thing or it's actually like many of us in Indonesia are like not empowered enough with the knowledge of mental health and also sexual and reproductive health, so that we are kind of like afraid to talk about it. And also, it also maybe we don't know that we have such a platform to discuss about that. The difference that between in America, it's more open because of maybe mental health and sexual and reproductive health has been an issue since a long time ago. So I think in America, the openness is actually we can feel the openness to talk about it. But actually, Indonesia and also US still have the same problem of like there's a significant difference between groups in terms of like the openness to talk about the mental health and also sexual and reproductive health. When we talk about like in the US, maybe marginalized groups such as like Black or BIPOC community, it's still like it's still not as open as what it should be in the general Americas. So I think that's the one thing that also happened in Indonesia. We know that maybe in Jakarta or a big city, mental health and also like sexual and reproductive health discussion is very open. But when we go out from the Java, like in Papua or Kalimantan, we know that this kind of thing is still like under discussed. So the youth or the young people in outside Java actually is having like a difficulty to discuss about this kind of topic. So I think that's maybe a little bit different between Indonesia and the US.
Thank you, Kak Wildan. So it's getting harder to talk about it, especially in the rural areas and among youths, because there is still a taboo culture towards these topics, and it's different with the U.S. Which is more open, right? So, I want to go to Miss Ashra. What do you think? How is the culture or the openness to talk about this or the access to healthcare for mental health and reproductive health among countries that maybe you've seen when you're working in the WHO? And how does the WHO in Indonesia make it more accessible, make the healthcare more accessible for youths?
Okay, thank you. That is very, very good question. So in general, being youth, when you started to enter the adolescence age, it started to be more sensitive, right? So firstly, when you're a kid, you don't really have responsibility, but when you enter the adolescence and going to youth age, you started to have responsibility, you started to have more relationships, you started to have to think about what you want to do in life when you are adult. And then the older you get, you started to have to make decisions, and it can lead to success or failures. So you started to have like all these pressures, and it's pretty much the same
all over the world. And since it's very sensitive to be adolescents and youth, so sending them on or ensuring that they have appropriate and adequate support in terms of health, social, education are very, very critical. Especially in Indonesia, I think in terms of mental health, the government have shifted. There's a paradigm shift of services of mental health since 2005, where before our option is only to go to mental hospital, but since 2005, the government started to bring the services much closer to home. So now, in many places, we started to be able to go to the puskesmas, to the general hospital. So mental hospital is not only the option that we have. And in terms of reproductive health, also the WHO has been assisting the government, has been working with the government along with the other UN agencies. We develop a platform where adolescents and youth can use it for study, for awareness raising, to learn more about how does it feel to be a youth and adolescents, and especially in terms of reproductive health. And also, it's called Belajar Kesga, and it's also used by some campuses for their to train their peers. Secondly, there's also outreach services to to ensure the health status and reproductive health status, notably, of adolescents and youth outside schools. So those who live in prison, for example, those who live in orphanage, those who live on the street or don't go to school, so they could be ensured that they could get the same opportunity and support with those who go to school. And lastly, we understand that health is not the only thing to maintain your health. So there should always also be the other aspect of life, and that's why the government created a policy called National Action Plan on the Well-being of Youth and Adolescents, called Ranpijar. Maybe maybe there will be more explanation about it. So basically, it's a multi-sectoral work to ensure the well-being of adolescents and youth. Thank you.
Thank you, Ms. Ashra. So we have Belajar Kesga, which is a peer support group at schools, right?
It's a platform to learn.
To learn about mental health and
reproductive
health. And then we also have outreach activities.
It's an outreach services by the health service providers called PKPR. Yeah.
PKPR to adolescent and youth outside schools, right? And we also have Ranpijar, which is the policy that support these interventions so that they are strong and comprehensive, right? So Mas Indra, would you like to elaborate? How about the government? What are the efforts that the government has been doing to increase awareness and access to healthcare for mental health and reproductive health?
Okay, thank you, Iren. But again, I will answer in Bahasa because we also have this majority of the audience, I guess, I think in Indonesia ya. Jadi ini selalu menjadi pertanyaan yang ditujukan kepada pemerintah. Apakah pemerintah telah memberikan atau menyelesaikan tugasnya dengan baik? Jadi apa yang tadi ditanyakan oleh Kak Iren, terima kasih. Kami dari pemerintah tentu sudah melakukan beberapa hal yang tadi juga disampaikan oleh Kak Wil dan juga oleh Kak Aca gitu ya. Sebelum ke sana, tapi saya ingin menjelaskan juga terkait dengan permasalahan. Tadi Kak Wildan sudah menjelaskan tentang pemahaman yang berbeda di Indonesia dan di Amerika. Itu juga sama sebenarnya. Itu masih menjadi permasalahan kita saat ini bahwa pemahaman masyarakat terhadap kesehatan jiwa gitu ya, atau kesehatan mental itu masih belum pada taraf yang sama dengan negara-negara di luar, apalagi di Amerika. Kemudian terkait dengan fasilitas, tadi yang disampaikan oleh Kak Aca juga sama. Fasilitas kesehatan yang menangani kesehatan jiwa atau kesehatan mental itu juga dari sisi kuantitas itu masih kurang. Kalau dari data terakhir yang saya peroleh itu ketersediaannya itu hanya ada di beberapa provinsi ya. Sebentar saya baca. Kemudian untuk apa namanya, tenaga kesehatannya sendiri itu kuantitasnya tidak merata. Psikiater di Indonesia sampai tahun 2022 itu hanya ada 1.053 orang. Itu perbandingannya satu psikiater untuk 250.000 penduduk. Jadi itu capek sekali. Kemudian untuk psikolog klinis itu hanya ada 2.900 orang. Di mana perbandingannya adalah 1/90.000 penduduk. Nah itu permasalahan-permasalahan yang memang ada dan dicoba untuk diselesaikan oleh pemerintah melalui beberapa kolaborasi, baik oleh pemerintah itu sendiri maupun dengan mitra pembangunan seperti WHO. Peningkatan fasilitas kesehatan mental yang sampai di level puskesmas, itu tadi juga sudah disampaikan oleh Kak Aca, itu sudah terus diperbaiki. Meskipun dari sisi kuantitas memang masih belum memenuhi harapan gitu. Kemudian terkait dengan program-program lain yang ada di kementerian selain kementerian yang membawahi kesehatan, Kementerian Sosial, program bebas pasung misalnya, itu juga menjadi salah satu perhatian. Meskipun tadi di dalam dialog informal dengan Kak Aca disebutkan bahwa sebenarnya pasung sendiri itu angkanya tidak jauh lebih banyak daripada permasalahan lain yang terkait dengan kesehatan mental itu. Kemudian dari sisi Kementerian Hukum dan HAM itu juga sudah mengeluarkan beberapa kebijakan seperti adanya kelompok kerja, pelindungan, pemenuhan, penegakan, dan pemajuan hak asasi manusia orang dengan gangguan jiwa. Jadi tadi kalau Kak pembawa acara menyampaikan apakah itu termasuk HAM, ya tadi sudah dijawab oleh pemerintah itu bahwa bahkan ada kelompok kerjanya begitu ya. Kemudian terkait dengan pemuda, karena ini saya hadir di sini kan mewakili unit yang mengurusi pemuda. Jadi terkait dengan pemuda kita ada juga namanya generasi remaja, genre yang ada di BKKBN. Nah, terima kasih kepada Pak Hasto, Pak Kepala BKKBN yang sudah mengeluarkan kebijakan satu desa ada 2 genre. 50.000 desa ada 2 genre, berarti sudah ada sekitar 100 ribuan duta genre yang ada di desa. Nah ini sangat membantu. Tidak hanya program-program yang di bawah koordinasinya BKPN secara langsung gitu ya, terkait dengan pembangunan keluarga, tapi juga isu yang sekarang sedang in yaitu stunting. Jadi duta genre juga diharapkan untuk bisa menjadi duta untuk penanganan stunting. Termasuk juga dengan genre itu ada namanya PIKR ya, Pusat Informasi dan Konseling Remaja. Nah ini teman-teman sebaya itu fungsinya sangat penting. Ketika pemuda mereka menceritakan dia itu cemas, dia itu depresi dengan orang tua, yang ada nanti bukannya mereka difasilitasi, tapi terus kemudian dijudge gitu ya. Nah itu pentingnya pemerintah memberdayakan dengan maksimal rekan-rekan pemuda, teman sebaya untuk bisa membantu para pemuda Indonesia. Pemuda di Indonesia saat ini itu ada 64 juta sekian di tahun 2023. Itu sekitar 24%-nya penduduk Indonesia. Jadi kalau angka dari Riskesdas itu misalnya yang depresi itu ada prevalensinya 1%, 1% dari 64 juta itu berarti 640.000 pemuda. Ya, jadi itu mengapa kemudian pemerintah menganggap penting kita harus bekerja sama dengan semua pihak, termasuk dengan pemuda yang melalui genre tadi. Mohon maaf kalau terlalu panjang. Silakan Kak Iren.
Gak apa-apa Mas, justru ini informasi yang penting gitu. So maybe I will just like summarize a little bit. There is 1 to 250,000 ratio of psychiatrists in Indonesia, which is still very small, and 1 to 90,000 ratio of psychologists in Indonesia, which is also very small. But the government has done a lot of efforts in trying to improve this condition. First of all, the Ministry of Law and Human Rights has a working group which guarantees that mental health is actually one of the human rights that needs to be enhanced in Indonesia. And then there is also the National Population and Planning Board, or BKKBN, which has some youth representatives in their own areas, which is called Duta Genre, Generasi Berencana, right? Also called Planning Generation ambassadors. And then there is also PIKR. PIKR is Pusat Informasi dan Konseling Remaja, or Adolescent Information and Counseling Center, where you can tell your peer support groups about your problems. So you don't have to tell them to your parents or like people who will judge you, but you can just tell them to your youth friends. And because youths make up 24% of the Indonesian population, so according to the research of the Ministry of Health, 1% of youths in Indonesia, which is about 640,000 of youths in Indonesia, has depression, which means that mental health is very, very important to be enhanced in Indonesia, right? So now I got a cue from Ed America that we're going to go to the next Mentimeter question. So yeah, we can discuss more about mental health by accessing this Mentimeter code, where the question is actually about what do you think about the awareness of sexual and reproductive health in Indonesia? So the first one is about mental health. Now it's about sexual and reproductive health. Okay. Okay, this is an interesting discussion. And we have some questions actually from the audience that we're going to address. So I will, this is a very interesting question. I will ask Mas Indra. How do you think that we can involve men in talking about mental health and sexual and reproductive health and rights, considering the norms and also traditional gender cultures that exist in Indonesia? Maybe I will ask Mas Indra and also Kak Wildan. Please, Mas Indra.
Iya, mungkin ini juga dengan pengalaman Kak Aca juga di WHO ya, sebenarnya sangat relate tadi ketika diskusi informal gitu ya. Bahwa ya itu tadi, pemahaman masyarakat kita kan masih rendah ya, terkait dengan kesehatan jiwa ini. Mengkontekskan pada apa yang ada di lapangan, pengalaman saya ketika masih kecil misalnya, ketika ada tetangga kita yang dianggap tidak normal, dalam artian mereka disebutnya mungkin orang gila, atau ya kita nyebutnya seringnya dengan orang gila gitu. Kemudian keluarganya memasung yang bersangkutan gitu ya. Itu sebenarnya kan kita tidak diajarkan juga oleh para tetua kita. Karena apa? Terus kemudian penanganannya atau perlakuannya yang baik itu seperti apa gitu. Sehingga kalau tadi Kak Aca di informal bilang, yang ada itu angka ripasungnya yang tinggi. Pasung awalnya, pasung yang baru, begitu itu kecil. Tapi ripasungnya yang tinggi. Jadi ketika yang bersangkutan dipasung, kemudian dimasukkan ke dalam lembaga kesehatan, fasilitas kesehatan seperti rumah sakit jiwa, sudah dianggap bisa diterima oleh masyarakat, kemudian kembali ke keluarganya, tapi kemudian tidak lama dari situ kemudian akan dipasung kembali. Nah, pemahaman-pemahaman yang seperti ini yang seharusnya kita ini lebih banyak lagi diseminasi dan sosialisasinya. Termasuk juga kepada generasi muda. Media sosial itu kan sangat berpengaruh ya, apalagi dengan jumlah kepemilikan HP pemuda itu berdasarkan statistik pemuda 2023, di atas 98% itu pemuda punya HP. Dan di atas 90% juga pemuda menggunakan internet. Untuk media sosial itu 80% lebih. Nah, itu akan lebih baik digunakan juga sebagai media untuk diseminasi dan informasi. Ya, mungkin itu salah satu jawabannya yang awal. Monggo Kak Wildan.
Ya Kak, mungkin tambahin juga gimana kita melibatkan laki-laki ya di tengah kultur Indonesia gitu. Silakan Kak.
Yeah, so I think the involvement of men when we talk about like sexual and reproductive health and also mental health is actually it's actually very important because when we talk about one of the problem of about the sexual and also reproductive health is that most of the women or girl in Indonesia, I rely on their men counterpart, whether it's like father or it's like brother or maybe a husband, right? So actually involving them in the discussion of like sexual and reproductive health and also mental health is very important. So that one of the problem is that many men, many like husband or father or brother didn't have like a proper knowledge of what is exactly their a female counterpart are feels like or they what they need. So that's actually why the involvement of men is actually very important in this, so that men can also understand how women feels like, what women need in terms of like mental and also sexual reproductive health. The, how to involve men in this case is that because we know that we have like very patriarchy culture, right? So actually, there need to be a balance between the role of man and also female in terms of like the discussion. So we don't want like all men panel in the gender discussion. We don't want that. We need to involve women and also men in the same like foot level, in the same right, in the same responsibility to talk about reproductive and sexual health and also mental health. So I think that's one thing. The second thing is that the use of social media is also, like Mas Indra said, that 98% of youth has phone. So actually, to make like a very good content that represent female, both men and also female in the sexual and reproductive health is actually the best thing to involve men in this case, because we know that social media thing is very big, that have very big impact in the youth. So I think the discourse and discussion in the social media need to be like more massive and also include both men and also female perspective.
Oke,
Thank you.
nambahin ya, Kak.
Ya, boleh, Mas.
Iya, saking semangatnya bahas kesehatan mental, jadi lupa jawab yang tadi itu. Jadi salah satu fungsi Peak R itu juga itu sebenarnya. Kalau generasi berencana itu ada triad KRR gitu ya. Jadi triad KRR itu, ini jangan disimbolisasi dengan pemilu ya, tangan saya ya. Triad KRR itu yang pertama itu terkait dengan pencegahan perkawinan anak, yang kedua terkait dengan penyalahgunaan nafsa, yang terakhir itu terkait dengan kesehatan reproduksi. Nah, jadi di genre itu sendiri, komunitas yang menurut saya itu sangat memiliki equality gender. Cowoknya juga banyak di sana yang juga memiliki concern yang sama terhadap kesehatan reproduksi. Jadi ketika tadi ditanyakan laki-laki gitu ya, saya kira melalui pemuda-pemuda itu kemudian kita sudah mulai membiasakan bahwa kesehatan reproduksi yang disampaikan oleh laki-laki bukan hal yang tabu lagi, bukan hal yang jarang lagi, karena beberapa rekan genre yang saya kenal, duta genre itu juga banyak yang laki-laki yang juga ikut di dalam beberapa kegiatan terkait dengan diseminasi dan sosialisasi terkait dengan kesehatan reproduksi. Bekerja sama dengan Kementerian Kesehatan di Direktorat Kespro ya, begitu.
Okay, thank you, Mas Indra. Kak Acha, do you want to add something to that?
So I think in addition, firstly, we have to understand the role why male or men should be involved in this. It's not about the quantity. I think the world is changing. So before, if a lot of things are done by, a lot of domestic things are done by women, and a lot of men go out from home and work. But now it's changing. Men also become house husband. Men also becomes stay-at-home person. And in terms of reproductive health, although the effect may be seen more to the women, for example, the unwanted pregnancy, the marriage, the young age marriage, but you know, men also have, is also an equal player in this case. Like you cannot get pregnant without men, and you cannot, if like you, although now we can have like different types of relationship, but also men have equal thing in terms of mental health, especially. Um, if for peer support, it is more comfortable to discuss maybe specific topics among men instead of men and women, right? It's about comfortable level. So I think why not men, becoming more cadres, health cadres, or providing peer support. I think the world is changing and we can adapt to it. Thank you.
Thank you, Kacha. So I think one of the ways is by involving men in this panel as well. Also involving men and also young youths who are men in the movements that just now Mas Indra has already described. Okay, so now we want to see again the Mentimeter. Now let's talk about this Mentimeter for a while. So yeah, a lot of people say that it is still taboo to talk about mental health and reproductive health in the community where they live, yeah, which is around their area. And then we go to the next question. Okay, now let's discuss about this. In your opinion, how accessible is mental and reproductive health for Indonesian youths? Okay, we will be waiting for a while for the responses. Not accessible, directly, the answer. Oh, that's one accessible, not very accessible. Mostly not accessible, yeah. Maybe in terms of, I don't know, in my experience, my personal experience, it's very expensive, to be honest. It's very expensive, so it's not accessible because of that. Yeah. Not only we should pay a lot of money for the consultation, but also the medicine.
But for the consultation, I guess we have BPJS Kesehatan ya, dan ini di cover. Jadi untuk pemuda Indonesia kalau terkait dengan kesehatan mental yang sudah mendaftar di BPJS Kesehatan, itu sebenarnya sudah di cover biayanya oleh BPJS juga ketika kita ingin berkonsultasi gitu ya. Nah untuk detailnya nanti bisa dibuka-buka lamannya BPJS Kesehatan.
Terima kasih Mas Indra. Oke, kita ke pertanyaan. We go to the next question now, the third question. What are your hopes for mental health access in the future, especially for Indonesian youths? Okay, while we're waiting for these responses, I would like to respond to BPJS Kesehatan ya Mas, because I have ever used it actually. Maybe Kak Wildan or Miss Acha want to elaborate more. But I have ever used BPJS and it takes so long to wait for the healthcare practitioner. Also, I cannot choose the doctor because sometimes when we have, because I also suffer from depression. And so once I consulted about my depression to one doctor, it's a little bit annoying if we have to change to another doctor, right? We actually want to just tell the same problem to the same person who actually knows our progress. Yeah, so that's actually the hurdle is there. But I find it very interesting though that it's covered by our medical insurance because I feel like at least we can reach the first aid response in the hospital. And so thank you to the government for providing us and it's covered by the medical insurance. Maybe Kak Wildan or Kacha wants to respond about the affordability.
Thank you so much, and thank you for sharing. I think it's not always easy for everyone. In terms of the mental health service coverage, it is true that we now have it not only in mental hospital, but also in general hospital and puskesmas. And also there are some outreach program to the community. For example, some area might have support groups, home visits. So it's still not the same on every province. However, we're going there. hopefully in a couple of good years. Um, in terms of the BPJS covered service itself, um, I think for mental health specifically, it's good. And in terms of, like a long queue and you cannot choose the doctor, it's the same mechanism with other types of disease. It's not only the mental health issue. Um, you have another disease, it's also the same thing that you have to go through. And it's good that you say this, and especially when there are like people from the government, maybe. So it's an input for the government, especially to improve the services. It's there and it's professional. Please use it. Maybe now it may be challenging, more challenging to many people. However, at least it's much closer to home now, and hopefully it will be like there will be more and more available, and so it won't be an issue anymore in terms of like choosing or having preference of getting the treatment for mental health. Thank you.
So seconding to Aisha said that the access for mental health and also sexual and reproductive health is it's always a problem since a long time ago, but currently with all the effort that the government and also like a development agent doing is that bring those access closer to home. Like I just said that we have outreach program, we have also like more community-based mental health services. I think that helped a lot since BPJS also covered those things. So at least we have now a better access to those kind of health facility or like help. When we talk about like 10 years ago, it it's not even there. So that's why I think it's also a progress that we can also thank to the government. But yes, there is still a room for improvement, especially for like the long queue and then the disparities between each of the region. We know that yes, we can access those kind of thing here in Jakarta, maybe a little bit easier than our counterpart or our friends there in Papua or in Sulawesi actually. So that's also a big problem here in Indonesia. And then like you said that we cannot choose our doctor. Yes, that's true. And that's why we need to have like a proper like a medical record so that whoever doctor that see you knows what are you doing now and then like what kind of medication that you have right now and what are the progress of your medication. So that's also a big room for improvement in this case.
Silakan Mas.
Iya. Eh, Menjawab yang tadi disampaikan pengalaman langsung dari moderator kita ya, Kak Iren, bahwa ya permasalahan itu seperti tadi disampaikan Kak Aca terjadi di penyakit-penyakit lain juga gitu ya, tidak hanya di penyakit terkait dengan kesehatan mental gitu. Jadi memang itu fakta dan yang terus dicoba untuk diperbaiki. Sejauh ini kami kan juga ada unit yang mengurusi itu di Kemenko PMK ya. Ada juga Dewan Jaminan Sosial Nasional yang ada di Kemenko PMK juga, itu juga membawahi BPJS Kesehatan dan BPJS Ketenagakerjaan yang selama ini juga terus membenahi bagaimana sistem yang terbaik ke depannya. Tapi memang di lapangan fakta-fakta tadi memang terjadi begitu. Nah, kalau di Kementerian Kesehatan sendiri sebenarnya terkait dengan kesehatan jiwa ini, Direktorat Keswa itu setiap tahun melakukan screening ya, bahkan itu menjadi salah satu indikator kerja utamanya mereka gitu. Ada IKU untuk screening penduduk yang memiliki resiko kesehatan jiwa gitu. Di samping juga mereka melaksanakan peningkatan Fasiankes terkait dengan gangguan jiwa. Nah, screening itu seperti apa sih? Jadi berdasarkan laporan dari Dirkeswa di tahun 2022 itu ada sekitar 52 juta penduduk Indonesia yang memiliki resiko masalah kesehatan jiwa. 52 juta. Jadi banyak ya, sekitar 20% ya. Ya itu dicoba meski tidak semuanya karena kan keterbatasan anggaran pemerintah. Jadi screeningnya hanya bisa berapa persennya. Nah itu screeningnya ada yang untuk usia 15 sampai 18 tahun, kemudian ada yang usia lebih dari 18 tahun. Di mana penyelenggaranya itu ada juga yang dari fasilitas kesehatan primer, tapi juga ada yang masyarakat. Tadi juga disampaikan oleh Kak Aca bahwa ada beberapa unit yang memang saling bekerja sama terkait dengan hal ini. Nah, sementara untuk pelaksanaannya itu selain tenaga kesehatan yang khusus menangani KESPA juga ada guru-guru yang memang sudah terlatih gitu. Jadi kalau usia 15-18 kan biasanya juga masih usia sekolah ya. Itu juga menggunakan metode SDQ kalau tidak salah, nanti bisa dilihat di lamannya Dirkeswa. Bahkan pandemi kemarin itu pemerintah juga menambahkan salah satu tools yang bisa diakses oleh penduduk. Kita tahu pandemi itu tingkat stresnya itu tinggi, 2020, 2021, 2022 kemarin. Sehingga kantor staf presiden bekerja sama dengan Kemenkes, bekerja sama dengan mitra pembangunan itu membuat sebuah hotline ya. Hotline-nya terkait dengan kesehatan jiwa, sejiwa itu kalau tidak salah namanya si jiwa ya. Terima kasih Kaca, si jiwa, dan ada hotline-nya 119 extension 8 kalau tidak salah. Jadi itu banyak diakses pada waktu itu. Mudah-mudahan sampai saat ini juga masih bisa diakses terkait dengan hal ini karena itu adalah salah satu bentuk real dukungan terhadap fasilitasi penduduk Indonesia terkait dengan KESWA.
Thank you Mas Indra for the elaboration. Jadi teman-teman yang mungkin mengalami isu kesehatan mental dan reproduksi bisa langsung akses apa yang tadi Mas Indra bilang ya. Ini I speak in Indonesian but again in English now. I mean like the government and also the UN agency, and I believe all youths also have tried to make mental and reproductive health more mainstream and also closer to the community. And it's very important, like what Kak Aca said about community peer support groups. And even I also met a researcher from UGM who is trying to have this community-based intervention to make families and also friends the caregivers of mental health, people with mental health issues, so that they don't have to go to hospitals, they can actually be taken care in their homes. And it's actually a very good initiative. And that researcher is now collaborating with Kemenkes as well, so like there are a lot of improvements actually. Okay, now I want to go to the offline audience. So is there anybody here who would like to ask a question? Okay, there are two, three, which is good. Okay. Okay, the mic runner is really running to give the microphone.
Sambil menunggu mic ya Kak Yaren, bahwa ternyata keluarga orang dengan gangguan jiwa itu juga merupakan mereka yang beresiko. Beresiko KESWA juga gitu. Nah itu juga salah satunya, iya.
Okay, please Kak.
Thank you very much for the opportunity here. I would like to introduce myself first. My name is Jessica, I'm a physician, but today I would like to wear the cap of the co-founder of Be There Manado, which is an organization for youth. We are mostly based online, but what we do is increasing the awareness of the youth in Manado about like mental health issues and how to get help. So the first question is directed to everyone on stage. So as someone who provide a platform for awareness, of course we're doing a good thing, but then because we're reaching like a lot of youths, right, who like Mas Indra said has social media. But then we can see that the stigmatization regarding going to a psychologist or psychiatrist is still prevalent. So what we do sometimes can backfire to us. For example, they would self-diagnose because now they know like what are the symptoms of depression, what are the symptoms of anxiety, and they're like, oh, maybe we have this. And that is not what we want. So what I want to ask is, does anyone know what is a good practice that you have maybe seen in other platforms or in other area, which is not Manado for sure, but maybe something that succeeded from online platform, how they screen for a youth who might be needing help, like professional help, and how do you successfully direct this youth to an actual professional and ended up getting the help that they need. Secondly, maybe the question is more directed toward Mas Indra. However, Acha, who works in a development agency, might also be involved in this kind of issues. So coming from Sulawesi, as Wildan mentioned before, we have like, I think only 6 active psychiatrists by this time. And so after conducting a research in 2019 in the district of, of North Minahasa, we found out that from the 4 puskesmas we went to, none of the puskesmas had a dedicated clinic for mental health. So that first. And second, none of the health professionals there, be it like a nurse or the doctors, none of them has had a training that equipped them with the ability of diagnosing and giving the first line treatment to people suffering from mental health issues, and then maybe referring them to a higher health facility. The question is what the government is planning in order to, to kind of not providing accessible mental health services even in the first level of health facilities such as puskesmas or like private clinics, or like what are the efforts to build the capacities of these health professionals so that the people in areas such as North Minahasa where no psychiatrist exists or no psychologist is also there and they have to go to Manado to get this kind of professional treatment. What are the government's plan to prevent this from happening so they don't have to go that far to get a professional treatment? Thank you.
Thank you, Ka Jessica. It's a very wonderful initiative, though, that you're doing. Thank you so much. But now we will collect the questions first so that I can summarize the questions. So we will go to the next one. Mas yang itu yang pakai baju, green. Okay, please.
Hello, my name is Nurman. I want to ask about talking about mental health and sexual issues is more about having a safe haven or a community that we can trust it to share the information, our personal information, but somehow that, like you said before about social media and something that we are afraid that when we talk these personal issues to someone, this person will judge us or will share it to the social media. And my question is, how do you improve or how do you increase the awareness of the confidentiality when people share their personal information, or even if there is a community that can collect this personal information? Do you have some NDA or non-disclosure agreement that you wouldn't share this personal information to someone else? Thank you.
Thank you, Kak Norman.
Nurman,
thank you so much for your question. And to the next one, Kak, please.
Okay, hello, thank you. So my name is Fatima. I'm actually founded organization that focus on teens' mental health, specifically 13 to 24 years. And so we've been doing kind of interviews and observation on what's the root cause from teens' mental health, in which we only been interview a couple of teens, but we found that the most significant stressor or issue is family or parents. I also go to psychiatrists, and I also joined support group mental health. I joined like 3 or 4, and unfortunately, since I'm still a teen, so most of my friend teens do. Most of them didn't tell their parents they go to psychiatrists or psychologists or even having or dealing with mental issue. What I found the problem is supergroup is really a great move. Unfortunately, when they comes back home, that's where like they spend their everyday life there. They interact with their family every day, but they're the greatest stressor. And what I found a nice quote is that you can deal with teens without dealing with their parents. And what exactly can we do about it? You know, like since some say that a family issue is something personal, it's not something we should barge in. But I think it's really important in order to help the teens who are struggling. Thank you.
Thank you, Kak.
Fatima.
Thank you, Kak Fatima. I think I know you.
Yeah, I do.
Okay, thank you, Fatima. So there are 4 questions that I cannot summarize because all of them are different questions. But maybe to set up the context first, as a person with mental health issue, it's very interesting because at first I couldn't share about what I am going through with my parents at all. But right now, my father is my greatest supporter. So it's very weird because he is my parent and he is a man. And my depression actually stemmed as well because there is a question about what is actually the relationship between mental health and reproductive health, right? It's actually interesting. My depression actually stemmed from my non-awareness towards what is friends with benefits. And then I was trapped in a friends with benefits situation, and then I got depressed. And right now I have a chronic bowel disease. Chronic means until today I still have it, and there is no doctor in Indonesia that can cure it. So it is very related. But and then I told about that story to my father, and he forgave me. I am actually very grateful that I have an open-minded father. But I also, as a content creator about mental health, I also receive a lot of questions like, how can we increase the awareness of our family because of even though we have support groups, but then we come back to our homes. So I think it's actually a very interesting thing to discuss. Yeah. So maybe I will go to Kawildan first. How do you encourage youths to find maybe other practices? So even though at home they feel like they're not comfortable enough, but they can get other solutions outside home.
Yeah. Okay. So basically, the question is also answering about Jessica's question. So Jessica is a friend of mine. Hi, Jess. So one thing about social media is that we know that we address one part of the problem, which is the lack of information. But then we cannot address the other part of the solution, which the access or like the openness to talk about this kind of mental health to provisional or to others support system, right? So I actually have this one example that a Singaporean do in terms of like a social media campaign. So they have this kind of like campaign called TikTok Youth for Good campaign. So it's actually a very, very interesting case where they also collaborate with 51 content creator in TikTok to raise awareness about mental and also cyberbullying, something like that. Because in Singapore we have like uptick in the number of people which have youth with have mental health and also cyberbullied. And this kind of thing is that they can spread a lot more information in this, but then they have like this expansion of this campaign. So the first one is that they encourage a lot of like counselor, psychiater, psychologists to join them in the ecosystem of TikTok, so that the youth now is currently like, oh, so they're also like join us, so they're part of us. So that's why the stigma or the barrier here can be decreased. At least they know that, oh, these people can be trusted because we're vibing, right? So yeah, so that's one thing. The other thing, the expansion, is that they have this kind of like offline training that are targeted to the young in the like junior high school or senior high school, and provide them with the training of like empathic listening, so that they can like actually find their peers that they think, oh, I think my friend have a problem, so that I can help them to like, at least I can listen to them, and then I can encourage them to get the professional if available and if applicable. I think that's kind of a thing that are very, very interesting in this case, because we don't just like use the social media as like information to spread the information, but we can do much more than that using social media.
That actually answers the question though. Thank you, Kawildan, for sharing good practices. Maybe Mas Indra wants to add something.
Iya, perencanaan ya tadi, tapi dimulai dari stigma dulu. Stigma ini tidak hanya terjadi di kesehatan mental saja sebenarnya. Permasalahan sosial lain yang ada di masyarakat juga sama. Perkawinan usia anak misalnya. itu stigmanya juga sangat susah untuk dihapus. Di salah satu daerah bahkan itu didorong oleh para pemuka agama karena terkait dengan misalnya zina gitu ya. Nah itu malah mendorongnya untuk perkawinan usia anak jatuhnya. Nah stigma seperti ini sebenarnya yang coba didorong melalui rekan-rekan di lapangan, baik itu dari sisi tenaga kesehatannya maupun dari sisi kalau tadi saya sampaikan peer groupnya dari duta genre gitu salah satu contohnya. Jadi stigma yang ada di masyarakat ketika kami dari pemerintah sudah memberikan diseminasi dan sosialisasi terkait itu, yang mungkin tidak diterima dengan legowo oleh masyarakat, oleh beberapa pihak, kemudian dibantu oleh rekan-rekan tadi yang misalnya para pemuda kita yang ada di lapangan. Mereka mencoba untuk mendobrak itu. Ketika pemuda yang maju, kemudian para tetua adat, tetua agama gitu ya, itu mencoba untuk bisa menerimanya, bekerja sama dengan tentunya para pejabat pemerintah di lapangan, misalnya seperti lurah, kepala desa dan sebagainya. Nah, untuk contoh baiknya sebenarnya yang sudah kami kerjasamakan antara Kemenko PMK gitu dengan salah satu Persatuan Kedokteran Indonesia ya, CIMSA, itu adalah kita mendorong untuk adanya diseminasi dan sosialisasi secara masif terkait dengan kesehatan mental. Pada tahun 2022 kami menyelenggarakan talk show nasional terkait dengan ini bekerjasama dengan CIMSA dan juga disupport oleh Bapak Menko. Karena pada saat itu kita mengetahui bahwa banyak sekali permasalahan kesehatan mental yang menimpa rekan-rekan pemuda di Indonesia. Jadi itu salah satu contoh kegiatan yang dilaksanakan oleh kami di Kemenko PMK terkait dengan keberpihakan terhadap permasalahan kesehatan mental, kesehatan jiwa. Nah, di beberapa di beberapa kementerian lain tadi sudah saya sebutkan di awal, salah satunya juga menjawab pertanyaan yang kedua terkait dengan kondisi nakes yang masih kurang dan bagaimana caranya untuk bisa memenuhi itu gitu ya. Ketika tadi disebutkan psikiater itu 1/250.000 penduduk, kemudian psikolog klinis itu 1/90.000 penduduk. Nah, itu sebenarnya sudah dicoba untuk dikurangi gapnya. Tapi kembali lagi, ketika kita di pemerintahan itu selalu terkait dengan anggaran. Guru itu kurang ya. Itu sudah diyakini oleh semua masyarakat bahwa guru itu kurang. Tapi ketika akan menambah guru itu akan berdampak dengan kekuatan anggaran juga. Hal yang sama juga terjadi di kesehatan. Menambah dokter, dokter itu untuk bisa diterjunkan ke daerah terpencil misalnya, itu juga akan terkait dengan anggaran. Belum lagi kembali ke permasalahan individunya. Apakah para dokter, ini Mas Wildan kan dokter juga ya, yang sudah lulus kemudian mau berdharma bakti kepada Indonesia untuk bisa terjun ke lapangan gitu. Terjun ke pelosok Papua. Tadi disebutkan kalau di Sulawesi Utara ada 6 psikiater. Di Papua, di NTT itu perbandingnya lebih jauh lagi. 1 berbanding berapa puluh ribu penduduk. Saya lupa tapi kemarin saya sempat baca itu. Jadi memang di daerah-daerah, apalagi di luar Pulau Jawa lah ya, kita sebutnya seperti itu masih gapnya masih tinggi terkait dengan ini. Nah, perencanaannya ya setiap tahun pastinya kami dari pemerintah berusaha untuk mengurangi gap itu, meskipun mungkin belum terlalu terasa ya, karena perbandingannya masih terlalu tinggi. Menjawab yang lainnya juga atau? Oke, siap.
Okay, maybe let's address this in a more practical way. Before, like we want to try to provide help or support to people, firstly, we need to understand that it's okay to have mental illness. However, it's not okay to self-diagnose it. we need to have appropriate help by trained and or professional people. That's why the government provides, more access and try to bring the service closer to home, so that the help-seeking behavior may improve. But what is the connection between mental health and reproductive health? There's a very, very strong connection. And not only mental health and reproductive health, but also other types of health issues. When teenager or adolescents or youth, they have pressures from the media regarding body image, diet. Like these days, there are a lot of like skincare products that promotes glowing skin, for example, certain body weights, for example, and also promoting certain types of behavior or relationship. Teenagers receive this kind of pressures from different directions, and they need to decide what's the best for them. A lot of times it can be successful, a lot of times it can be failures. When it's a failure to them, it could lead to unwanted pregnancies, premature marriage, and then also contracted diseases like HIV/AIDS, or they would prefer to take drugs, or they would perform like even more risky behaviors, such as driving while under influence of alcohol, and then also violence, and that could lead to a lot of stress, a lot of mental health issues. That's why when you look into the internet, a lot of numbers of this number, one every certain numbers of adolescents have mental health issues. One every certain adolescents, cause of deaths due to mental health issues. That's the connection. So the risky behaviors may lead to different types of mental illness and even lead to death due to mental illness. And as you know, like suicide is among the top 3 of the leading cause of death among adolescents around the world, and including Indonesia. Maybe the number is not yet like very detailed, but we can assume that it's also there. And also regarding the support, it's very nice to know that like organizations like Jessica have this kind of initiative to provide support, and it can be in different platforms. When providing supports, firstly, you need to understand that mental health is really, really related to the culture, how people live, how people have relationships among others and with themselves. And so any kind of support, if you target Manado, it should be unique to Manado first, because that's your target. If you target all the teens and youth all over Indonesia, we need to, be mindful of how they live their lives, what kind of cultures that they have, what kind of likes and don't likes that they have, that we can start from there, to provide supports. There is one like KPSI. It's a community of family to provide support for people with schizophrenia in the beginning, but now it's people with mental health issues. What they do, they used to be very big in Facebook. Their support is very simple. If you have mental illness, you just come and join the group and ask, I have these symptoms, what should I do? And a lot of times people there would say, you need to seek professional help. If you can't go where you live, let us know, then we will accompany you. That's the simplest support that people can give. And in terms of ensuring privacy, it is true that there is still gap about this. And sadly, among them might be coming from the professional. However, it starts from us. When we understood that it is something sensitive, you need to be trusted, and with this trust, you need to keep it, you need to maintain it, and only share it to the person who is qualified to have this kind of information, and with, very, very important, with the consent of the person, then everyone can be expected to do the same. It should start from us. We cannot expect people to do the same with us at the same time, because each of us might have different level of understanding, different level of knowledge of how important it is. I think that's all I can say. Thank you.
Thank you, Kak Acha. Maybe Mas Indra, you want to add something about the privacy issue?
Iya, kalau terkait dengan kerahasiaan gitu ya, mungkin ini nanti terkait dengan NDA lebih ke teman-teman yang bekerja di sektor kesehatan langsung ya yang bisa menjawab. Tapi setidaknya ketika di Kemenko PMK ada beberapa hal yang memang terkait dengan kerahasiaan itu di beberapa isu. Misalnya tadi disampaikan terkait dengan perkawinan usia anak gitu ya. Perkawinan usia anak ini salah satu contoh yang juga terkait dengan privasi juga, baik itu keluarganya maupun si anaknya itu sendiri gitu. Nah, yang dicoba oleh pemerintah adalah kita tidak berusaha untuk kemudian memblow up secara langsung yang bersangkutan begitu, tapi kita berusaha untuk menjembatani pemahaman yang dimiliki oleh orang tua gitu melalui fungsi-fungsi keluarga yang memang menjadi kewajiban dari keluarga itu sendiri gitu. Fungsi pelindungan misalnya. Jadi pendekatan terhadap orang tua, pendekatan terhadap tetua adat, tetua agama itu yang selalu kita jalankan agar hal-hal yang bersifat rahasia itu tidak kemudian bisa terblow up ke mana-mana. Misalnya ada yang yang sering terjadi viral kan, ada yang berusaha untuk tadi ya sebenarnya yang Kak Aca bilang, kalau memang kita memiliki simptom ya jangan berusaha untuk mendiagnosa sendiri gitu, tapi justru ke para ahlinya gitu. Nah, ketika di sekarang zamannya media sosial, kemudian ada yang berusaha mendiagnosa sendiri dan itu kemudian dipost, itu yang kemudian malah membuka kerahasiaannya dia sendiri kan begitu. Nah, hal-hal yang seperti ini yang kemudian terus didorong oleh kami, oleh pemerintah bahwa pemahaman baik itu orang tua maupun lingkungannya dan juga terhadap para teman sebayanya, peer group itu yang terus didorong agar kita sama-sama bisa menyelesaikan masalah tanpa menimbulkan masalah. Ini bukan platform salah satu BUMN ya.
Makasih Mas Indra. Kak Wildan, want to add something?
About the privacy, I think I don't think we can accept like us further as NDA because when we talk about like a support system or like with parents or with other friends, we don't have such kind of a legal to do such NDA. But I think one thing important is that to educate or like to give more knowledge that this kind of thing it's required privacy. Other than that, then to make the journey of the patient for mental health and sexual and reproductive health is like better, then we need this kind of privacy, and this need to be understood by every stakeholder or every people that are involved in this kind of like processes. So the knowledge and give them more information that privacy is important is actually like the best thing that we can do.
Thank you, Kak Wildan. So I'm going to summarize a lot of points actually. The first one, how to make mental health services more accessible. We can use our social media, definitely. All media platforms, youths, please share best practices that we find everywhere around us, so we don't do self-diagnose. So what I'm doing usually is that I always share that I have a mental health problem, but I also share the fact that I go to a psychiatrist and I am also taking medicines. So people will not self-diagnose because I try to tell my story from my own personal point of view. And then Second one is I want to highlight the need for a tailored intervention that Kak Acha highlight. That is actually one of our policy recommendation as well, to have research that is disaggregated with disaggregated data, considering the social determinants of health, so that the interventions done is tailored to the community needs, to the community context, including the peer support group, so that the first aid can be accessed easily and can be accepted as well in the community easily. And then the third is, I think what Mas Indra said just now, that they have a webinar together, a seminar together with TIMSA, right? We need to involve youths in the conversation, in the advocacy. So it's not only about practice or intervention, it's not only about like the healthcare practice or maybe the awareness side of things, but also the advocacy side of things. So I actually want to praise Kemenko PMK because every time I go to a youth event, there is always Mas Indra and Bu Lisa, to be honest. Like they both never skip youth advocacy events. So I really encourage you all to join all of these events and conversations with the government, because they really want to listen to us and to our input, so that we can actually converse with them and try to tell our aspirations to them. And it's very useful. As well, also Kemenko PMK was just established in 2019, right, Mas?
Kemenko PMK-nya 2014 sejak zaman Pak Jokowi, tapi sebelumnya kami namanya Kemenko Kesra, Kesejahteraan Rakyat. Jadi establishnya sudah sejak zaman Orde Baru sudah ada.
I see. Yeah, actually maksudnya it's one of the bentuk proof of seriousness from the government juga ya, karena ada deputi khusus untuk pemuda dan sebagainya gitu, which Bu Lisa and Mas Indra never skip kalau misalnya ada acara kayak gitu kan. So I mean like ini ada banyak hal yang sebenarnya dilakukan oleh pemerintah dan mendukung pemuda sekali untuk mainstream aksesibilitas dari healthcare services of mental health gitu. Nah mungkin sebelum kita ke pertanyaan yang terakhir, ada pertanyaan kedua terakhir. There's a second last question from me. I really want to dig deeper more about the relationship between mental health and reproductive health. Yeah. Just now Kak Acha gave a very interesting point of view. There is a relationship, for example, about how teens or adolescents or youths as well need to navigate themselves when they first come into the real world. Yeah. Maybe they need to, for example, youths like me, above 24, we need to find money, of course, right? There is the hustle culture youths in Jakarta. We are from cities outside Jakarta. It's quite confusing. The first time we went to Jakarta, this is a big city, different culture, so we need to navigate ourselves. And then high standards, body image, or maybe high standards of success defined by social media nowadays. It's very undeniably sometimes illogical. And so youths need to navigate themselves in these kinds of situations, and what kind of friendships that they need to have, what kind of relationships that they need to have, what is the boundary, right? So it is very related to one another. And just now Mas Indra mentioned about Triad KRR, so I googled it and it's very interesting. Triad KRR means 3 masalah pokok kesehatan reproduksi remaja, the 3 top issues of teens reproductive health, which are sexualitas, sexuality, and then napsa, narcotics, and also HIV/AIDS. So actually they are very related, because once maybe we, based on my personal experience, once we get the wrong, maybe we navigate ourselves quite not really in the correct pathway in this very big city, we can easily develop mental health issue, also risky behaviors like what you said. I also did get drunk before, and almost I also had depression before. So it's like a really hard situation, and there is a strong connection. So maybe Kak Acha or Kak Wildan or Mas Indra would like to add about it. Maybe from Kak Acha first.
Thank you. That's a very interesting point of view. And you mentioned something also about social determinant of health, and it's really actually about how the society and yourself put the risk of health on you. So the bigger the pressure, the closer you are to have a disease, to contract it from a disease or to have certain types of disease. So if you have a very ideal environment where people are very supportive, the government is very supportive, all the policies are very supportive and implemented very, very well in a correct pathway, then you will have a very beautiful life. You tend not to be sick. Even if you have problems, you are not afraid to seek help because it's there. And it's, I think we're going there. It's not ideal at the moment, but it's there, and we can start to get benefits from there. There might be like this and that. However, if you use it and you provide inputs, there will be it will be like an input to the government to improve the service quality in any type of disease, not only mental health and reproductive health. And then the other way is that any type of disease, including we talk about reproductive health and mental health, they also contribute to the burden of disease. For example, if you perform due to the issues in the reproductive health, you perform risky behavior, and then you are put into a lot of stress. You tend to get injuries because you drunk drivings, for example. You get involved into the traffic accident. As a result, you may become disabled at some point, also having depression because you cannot have the same productivity level as the others. And that's a burden to the disease. That's a burden to the government to ensure that there should be service allocated to ensure that you are fine. And so when we talk about mental illness, reproductive health, other types of disease, it's not only about the situation when you are sick, but it's also the situation when you should know how to maintain your health. That's the awareness and the knowledge. And then you should know how to ensure that you know where to seek help when you need it, and ensure that when you really need it, you go there instead of self-diagnosing yourself. And when you are discharged, you should also be ensured that you have the appropriate or adequate support to prevent you from going into the same sickness situation again. So I think all this concept can be interpreted in many, many ways. But to make such decisions, you have to always think about one action, even though it's not related directly to mental illness, for example, but it can lead to there in many ways. Thank you.
Thank you, Kak Acha. Kak Wildan?
Yes, I will be very short because Acha explained it very beautifully about social determinant of health. So yeah, basically health is very unique because when we talk about health, it's not just about the health factor, but we also need to consider like the other factor outside health that also influence health, which is like I just said, the social determinant of health. Nah. When we talk about the solution of health, such as like mental health and also like sexual and reproductive health, all we need to do is not just like addressing the health need, but also the factor that are outside the health, like culture, like economic, like as we discussed before, that economic and also stress navigating, like where do I get the money is actually like very, very triggering to a lot of youth here, so that they can come into the mental health issues or sexual reproductive health issue. That's also need to be navigated. So I think when we talk about the solution, all we need to talk is not just the health factor, but also we need to look abroad and look beyond the health, which is the social determinant of health.
Yes, thank you Kak Wildan. Mas Indra?
Ya, terima kasih Kak Iren tadi sudah meng-up terkait triad KRR ya. Jadi memang itu salah satu program yang dijalankan oleh rekan-rekan genre di lapangan. Jadi justru itu karena ada keterkaitannya antara mental health dengan reproductive health gitu. Di dalam RPJMN sendiri, ini saya bahasanya di unit kerja kami ya, peningkatan kualitas pemuda. Karena pemuda banyak dan akan berpengaruh di 2045 nanti. Jadi peningkatan kualitas pemuda itu melalui 3 strategi. Salah satu strateginya adalah terkait dengan pencegahan perilaku berisiko pada pemuda. Pencegahan perilaku berisiko pada pemuda itu menyasar apa saja? Banyak. Ada terkait dengan penyalahgunaan nafsa, perundungan, kekerasan terhadap pemuda, itu ada kekerasan terhadap perempuan, terhadap anak gitu ya. Terus kemudian terkait juga dengan kesehatan pencegahan perilaku seksual berisiko pada pemuda gitu. Jadi tadi yang disampaikan itu yang kami kerjakan. Yang tadi juga disampaikan oleh Kak Iren bahwa karena kami targeted ya, isu kami targeted pemuda gitu, jadinya kami berusaha untuk bisa menyelami semua hal yang terkait dengan pemuda, baik itu ya masalahnya, baik itu potensinya gitu ya. Nah itu yang terkait dengan strategi kami untuk peningkatan kualitas pemuda. Nah pastinya kita harus bekerja sama dengan pihak lain, oleh karenanya kami menggandeng mitra pembangunan. Mitra pembangunan itu seperti UN, terus kemudian ada juga dari Jerman, kami bekerja sama dengan, boleh nyebut merek gak sih? Boleh ya? Saya takutnya nanti di ban, enggak ya? Itu kami bekerja sama dengan Frederick Ebert Stiftung juga. Jadi ketika kami mencoba untuk membahas atau menyelesaikan masalah perundungan, kekerasan, intoleransi, kami bekerja sama dengan FES, itu punya namanya Sekolah Harmoni Indonesia. Jadi Sekolah Harmoni Indonesia itu berusaha untuk menyadarkan pemuda bahwa kita adalah bangsa yang beragam. Gitu. Jadi menyadarkan mereka kondisi kita seperti apa, faktanya seperti apa yang harus dilakukan bersama-sama. Itu menghadirkan pembicara-pembicara berkelas juga gitu. Baik yang di level nasional maupun di level lokal, karena kami juga tidak bergerak hanya di pusat tapi juga di daerah gitu. Jadi teman-teman yang berada di daerah juga mendapatkan informasi yang sama gitu. Nah kemudian terkait dengan pencegahan perilaku seksual berisiko, sudah pasti dengan genre, sudah pasti dengan Kemenkes, dan dengan salah satunya adalah dengan CIMSA gitu ya, karena mereka yang selalu mengajak kami di awal untuk bisa, ini kami membawa isu yang penting yang harus diadres juga oleh pemerintah. Salah satunya adalah kesehatan mental. Jadi itu yang yang dikerjakan oleh Kemenko PMK. Nanti kalau rekan-rekan sekalian tertarik, ya silakan dibuka media sosial kami, dan di sana ada beberapa tautan terkait dengan kerja kami, baik itu yang berupa talk show ataupun focus group discussion. Terakhir Kak Iren ikut dengan FGD kami, Suara Pemuda Menentukan Nasib Bangsa, Bijak Memilih, itu salah satu FGD berusaha untuk menjawab urgensi suara pemuda di fase pemilu gitu. Jadi kami berusaha untuk menyadarkan mereka bahwa yang dipilih itu bukan hanya orangnya, bukan hanya ketokohannya, tapi juga visi misinya ke depan, mana yang dibutuhkan oleh kalian. Ya, seperti itulah. Tapi ini belum closing statement. Silakan Kak.
Thank you Mas Indra. Jadi sebenarnya udah banyak banget kanalnya ya. Mungkin sedikit ini nih, ada point of view yang menarik juga. Sebenarnya not only adolescents ya, but also young adults. Jadi di zaman sebelum COVID itu young adults angkatan saya yang 24 ke atas itu kan we never accept information as massive as now ya, karena right now it's after post COVID gitu kan. Jadi I also make my own movement yang menyasarnya tuh lebih ke young professionals gitu loh. Jadi mereka also can do something terkait health juga gitu. Nah itu juga salah satu hal yang mungkin perlu diperhatikan juga, maksudnya not only teens, not only adolescents, but also young adults. Karena jujur ya memang just now like what Kak Wildan mentioned, it's not only about health but also about other aspects. Then it's very very complicated lah for youths juga gitu. And I also want to highlight, terima kasih lagi kepada Mas Indra karena Kemenko PMK sekarang misalnya nih kita ngundang Kemenko PMK gitu ya. Kemarin Kemenko PMK ngundang saya juga yang pas di gedung Kemenko PMK. Jadi kita bener-bener work very closely and they really listen to us. Jadi teman-teman pemuda, if you have any initiatives you can definitely go to their events dan juga tadi cek their social media ya. Dan juga WHO juga sekarang they do a lot of outreach activities juga ya Kak, ya kan?
So we don't provide direct services like that. However, we assist the government to ensure that appropriate support and services are developed and provided. Jadi seperti PKPR itu yang melaksanakan utamanya Kementerian Kesehatan dan di situ memang targetnya memang remaja dan anak muda. Banyak yang dilakukan seperti ada daerah-daerah yang punya posyandu remaja, kemudian juga ada screening di sekolah, kemudian ke kampus, ada gerakan kampus sehat yang diusung juga bersama dengan Kementerian Pendidikan. Jadi ini kerjanya adalah kerja barengan, jadi tidak bisa kerja sendiri, tetapi targetnya sama dan sifatnya pastinya harus menyeluruh.
Siap, thank you Kak Aca. Also, ini terakhir jadi last question, closing statement buat para pembicara. So ini jadi bilingual ya karena Mas Indra men-trigger saya untuk bilingual gitu. So okay ya, ini kayaknya audiensnya juga Indonesians. Okay, so the last question, ntar ini kenapa ya? Okay, according to the panelists, how can we all work together? Youths, also government, academics, and also development agencies to increase awareness and also access towards mental health and reproductive health services. So we will start from Kak Wildan.
Okay, so how we can collaborate together is that first, I think the openness for every stakeholder that are involved to make a collaboration. I think most of the time we see that, oh, I think government is not really approachable because we don't know how, right? So I think one thing is that to open up every stakeholder to open up so that they know that we can approach that, how we can approach that. So that one thing. The second thing is engagement. So youth, as we said, that like quarter of our population, right? So a youth movement is very, very big. So I think one of the things that we can collaborate together is that to use the movement of this youth is to like tie up all of the stakeholders together, because trust me, youth movement is very, very big. It's very, very significant, and it's very like apa ya? It's very moving, gitu. So I think the youth movement is also one thing that we need to consider to make it like bigger and make it like more accessible to all of us. Yeah.
Thank you Kak Wildan, Kak Aca.
Thank you. I think I will use bahasa Indonesia. Jadi ada dua hal sebenarnya adalah di tingkat personal dan tingkat organisasional. Di tingkat personal pastinya adalah help yourself first. Be mindful, kalau di kesehatan jiwa ya be mindful, kemudian juga harus aware of yourself and your surroundings. Then you can help the others. It's the same with any types of health issues. You have to help yourself first. Dan kalau sudah kita bisa melalui hal itu, kita mantapkan di usia kita sekarang yang masih teenager, adolescents, youth, young professionals, itu akan menentukan bagaimana kita menjadi seorang yang tangguh ketika kita dewasa. Bahwa masalah itu tidak akan pernah hilang, tapi bagaimana kita mampu mengatasi dan melewati masalah tersebut itu adalah yang paling penting. Yang kedua, di tingkat organisasional, ada banyak organisasi pemuda di Indonesia dari Sabang sampai Merauke. Pastinya pemerintah tidak mungkin bisa mencakup semuanya. Jadi organisasi pemuda ini merupakan level grassroots di mana anak muda pertama kali bisa dapat support. Dan karena itu akan sangat-sangat membantu bila organisasi pemuda juga berkoordinasi dengan pemerintah melalui platform-platform yang ada yang disediakan seperti yang disebutkan tadi, untuk menginform apa saja yang sudah dilakukan di level akar rumput. Nah, kemudian juga pemerintah ini kan punya indikator nasional, punya target yang mau dicapai secara nasional. Seringkali disampaikan dalam dokumen yang bahasanya belibet dan mungkin kita nggak punya waktu untuk mau memahaminya gitu. Tapi sebagai organisasi pemuda, apa yang bisa dilakukan adalah ayo kita buat versi easy read-nya sehingga lebih mudah dipahami oleh anak-anak muda di semua level literasi. Jadi kita tingkatkan literasi sehingga apapun support, inisiatif, program yang dilakukan oleh organisasi pemuda, kita bisa pastikan inline dengan apa yang ingin dicapai oleh pemerintah juga. Jadi secara tidak langsung kita juga berkontribusi terhadap pembangunan. Terima kasih.
Ya, thank you Kak Aca. Dan terakhir, lastly Mas Indra.
Oke, terima kasih Kak Aca, Kak Wildan, Kak Iren, Amerika juga rekan-rekan sekalian yang sudah hadir. 3 hal saja, jangkau kami melalui semua media yang bisa kalian jangkau. Kami itu tidak hanya Kemenko PMK, nanti saya dimarahin karena pemerintah itu banyak. Jadi kalau tadi Kak Wildan bicara tentang keterbukaan, kami insya Allah sudah terbuka. Terbukti dengan Kak Iren sudah sering mengikuti kegiatan kami juga. Nah, teman-teman yang lain juga silakan rekan pemuda Indonesia untuk bisa reach us gitu ya di semua media yang ada, baik itu media sosial maupun offline. Jadi banyak juga teman-teman pemuda yang sudah beranjang sana ke Kemenko PMK di dekat Monas sana. Kalau mau main tuh dekat Monas. Kemudian gunakan kami gitu. Jadi ketika kalian ada masalah, ketika kalian ada yang perlu disampaikan, ya sampaikan. Persoalan nanti masalahnya diselesaikan seperti apa, biar kami yang memikirkan gitu. Dari Kemenko PMK tidak bekerja sendiri, kami adalah kementerian koordinator yang membawahi beberapa kementerian teknis. Jadi ketika terkait dengan kesehatan, kami pasti akan reach out Kemenkes. Ketika isu pemuda, kami akan mengadres ke teman-teman di Kemenpora. Jadi kami tidak bekerja sendirian pun yang terakhir poinnya adalah kolaborasi. Kami tidak bisa bekerja sendiri. Pemerintah itu resource-nya itu terbatas meskipun sebagai wakil negara yang harus menjalankan tugas memberikan pelayanan kepada masyarakat. Tapi kami resource-nya terbatas. Oleh karenanya kami kami selalu menggandeng mitra pembangunan untuk bisa bekerja sama. Baik itu mitra pembangunan yang di level nasional, internasional, maupun di level lokal, dan juga targetednya. Misalnya pemuda, karena saya di Asia pemuda itu sering kami ajak. Jadi ketika kegiatan terkait dengan isu pemuda, pasti ada perwakilan pemuda di sana yang juga tidak hanya diminta untuk membantu teknis, tapi juga dari sisi substantifnya. Terus kemudian kolaborasi ini juga tidak hanya terkait dengan masalah anggaran gitu ya. Karena sering disalahartikan kolaborasi itu nanti jatuhnya proposal gitu ya, dapat anggaran. Tidak hanya seperti itu. Jadi kolaborasinya adalah kolaborasi yang substantif juga. Bahwa terus terang ketika kami kemarin di 2022 atau habis pandemi itu, kami justru diadres oleh teman-teman Cimsa untuk kesehatan mental ini. Memang sudah ada pembahasan, tapi ketika kaum muda yang justru mengajak kami, itu adalah salah satu nilai yang berbeda. Pun ketika kemarin kami mengadakan FGD Suara Pemuda, itu yang mengajak, yang memberikan ide untuk ada kegiatan itu, kemudian difasilitasi oleh FES dan juga dibantu oleh rekan-rekan Think Policy, itu juga teman-teman pemuda. Nah, itulah reach us, use us gitu ya. Ibaratnya silakan gunakan apa yang ada di kami, diberdayakan karena kami yang seharusnya juga memfasilitasi kalian. Mungkin itu.
Thank you, Mas Indra, and thank you for all the government officials who are open-minded and want to discuss a lot of things with youths, because I also experienced a lot of good experiences also, same. Misalnya kayak with the Ministry of Health, there is like an official who actually is open to collaborate, to discuss with us. So yeah, please reach out to the government officials as well. So before I give the floor back to the MC, I would like to summarize this conversation. This is actually a very beautiful conversation, though. So there are two things that we need to improve. Just now, what Kak Acha mentioned, organizationally or systematically, and also personally or at the individual level. So at the systemic level, first, we need, as youths, we can make our own movements, whatever initiatives they are. We really, really encourage you guys to share them with youths around you, to collaborate with your fellow youths, and also translate global health policies to local interventions, to local languages, to local initiatives, so that they are more accessible to youths in your local areas. And we need to collaborate. Yeah, we need to collaborate among government, among youths, among media, among development agencies, among embassies. Like right now, we're at the at America building with the U.S. embassy, so they're very supportive towards our initiative. And also at the individual level, yes, we need to be mindful and we need to help ourselves before we help other people. And just now, Kaacha put it very beautifully, how to be a resilient individual in the midst of all the problems that we encounter. Yeah, it's very hard to be a youth, but I think we can make an effort to be a resilient youth, and we can do it together. So thank you so much for Kaacha, for Kak Wildan, and also Mas Indra for this wonderful conversation, and for all the online, also offline audience. Thank you so much, and I am giving back the floor to the MC.
Thank you so much to our moderator and our amazing speakers. Once again, can we give a big round of applause? Thank you so much for the insightful discussion. Earlier at this event, we have trivia quiz for you who join us via online platforms. And the question was, is it true or false? Mental health is a basic human right. And the correct answer is true. It is crucial to personal, community, and socio-economic development. So congratulations to @SophiaStia from Instagram, who is the fastest one who can guess correctly. The last, we want you to collaborate with us by visit our website www.atamerica.or.id. You can click collaborate with us and submit your greatest idea. Also, to keep updated for our next amazing events here in @America, you can follow our social media. We have on Instagram, Facebook, X, YouTube, @America. Thank you so much for joining with us. My name is Patricia Elizabeth, and see you at the next @America event. Happy weekend, everyone.